on this episode of The Natural Plastic Surgeon.
That's also why I chose you, just because everything looked natural, and that was my goal in the beginning, like not wanting to go too big. I think at the end I kept telling you, I want to go bigger. I think I was kind of like, they're a little small, but honestly not a couple years, like a year or so after, I just started it just coming into my own. Like they kind of just felt like me, and like I was just like, you know what, they're perfect. I think I'd look crazy if I was like going any bigger. So you were right. So I'm glad I listened.
Good. So everybody, we're here. This is episode 36 of The Natural Plastic Surgeon, and we have our beautiful guest, Siobhan Garcia.
Yeah.
With the name change, you just got married recently.
I did, September.
That's exciting.
Yeah.
So just to catch you guys up, Siobhan is one of our patients that we did a breast augmentation on back in 2017, and at that time she was our first trans breast augmentation that we were able to publicly promote. And you can actually see this video on our YouTube that went mega viral. Okay, there's over 1 million views on this particular video, and I think it really opened people's eyes in terms of, breast implants are not just for cis women, they're also for trans women. Mm-hmm. And at this point, you had already been transitioned at the point, and you had breasts, and we're just like, hey, let's make them fuller.
I was on the hormones and had breast tissue already, so that also helped a lot. How soft they are, I was really worried about that.
Yeah.
About hard boobs, because I've seen a lot of those, and that's definitely something that I didn't want.
Yeah. So tell us about that process. Let's rewind the clock. 2017. That was like 5 years ago. It was a different office. Crazy. How did you find me?
I actually found you. You were following some nightclub that I was like going to, and then I was like looking through the followers for some reason, and then I noticed like a plastic surgeon was following them. I was like, oh, I don't know, just clicked on your page, and then I seen you, and then I saw your before and after. So I was like, oh my God, they're so good. And I was like, this is like the kind of look I'm going for. And then I just gave your office a call one day, and I thought that was moving on its own. And that's that. And then I had my consultation with you, and I think it was like 2 months after I ended up getting them. So.
Yeah. Did you have any other consultations?
No, I went to nobody. You were like the first one, and then I liked what I saw, and thank God I did, because I've recommended you to like a lot of people, and I think a few of my friends have come and gotten them done since me.
Yes.
So everyone was like very impressed.
Yes. So I actually do a fair amount, probably 1 or 2 trans breast augmentations every week. It's very it's a very popular procedure that we do in our office, and they're similar in some ways to a cis breast augmentation, but they're different in a lot of ways. And so a lot of the techniques that I use for your breast augmentation, I incorporate. And so, making it look natural. So like we went underneath the muscle for you. Yeah. Yeah. So a lot of times Do you do a lot of above muscle? I don't. Oh, okay. And the reason why is because the implant looks very noticeable when you do that. How do you feel about how yours look now? Oh, I mean, like, whenever, like, I've had a few people tell me in my single days, like, are those, like, real? Yeah. And I'm just like, I know, like, it's good, like, a good doctor, whatever. So everyone always compliments my doctor. Yeah. And, they've just, I mean, the only thing with under the muscle is like if you like lift yourself up, you can kind of and that happens with cis. But so there's that slight disadvantage, and we haven't quite figured out how to. But I mean, no one really notices that, honestly. Yeah, you can control it too. Usually, anyway. So. Yeah, exactly. Well, that's good to hear, because so that's one of the things that we do is I almost all the time go underneath the muscle, and it's really difficult to do because there's a lot more muscle there, as you can imagine. Right. And we also do an extended release to allow more cleavage. We allow space for the implant, because if you go underneath the muscle and it's a strong muscle, it can actually push down and you get a lot of bottoming out. So you'll see that sometimes. Yeah, that's something you mentioned a lot. Also, I remember you mentioned you had to like kind of cut, or I don't know, somehow go in between so I could go more. You like kind of cut underneath the muscle here in the chest, so I could go more closer together. Yeah, that's the extended muscle release that we do. And that's kind of key, because it allows you to get your breasts closer together and get more of that cleavage, which is always a kind of a struggle with a lot of our trans patients. Not always, but sometimes, majority of times, to get that cleavage in the middle, especially if you're not wearing a bra. So, right. Yeah.
The other thing is also incision, border the areola incision.
Oh, I love the areola incision because a lot of my friends do have like the underneath boob, and you can always basically notice the scar if whatever, and that's something I didn't want. And like my scars have healed like so good. I think there was a little issue with my left one, but like you just like shot it up with something and it went away. I love that.
And that happens. Got to be careful with it.
That worked really well.
Yeah. So that's the other thing. And I don't know anybody that does underneath the muscle and periareolar incision, which I think is the best way to do a trans.
Oh, you don't?
No,
Okay,
I think majority of doctors, they go above the muscle because it's a lot easier. You don't have to deal with the muscle, and they do the inframammary incision, which I think is a mistake because that weakens the bottom part of the breast.
Yeah.
So the implants start out high and then they drop down.
I've seen a few that also look flat underneath. Like it makes the boob look kind of flat.
It does, especially if it's scars, right? So you get a little shelf, right? And so that is also like super noticeable too. So if you're wearing a bikini and you raise your arms up, it's like, oh, okay, you had something there.
Yeah.
You know, and maybe they don't know.
Yeah,
exactly
that's something I didn't want. So that was also why I chose you, just because everything looked natural. And that was my goal in the beginning, like not wanting to go too big. I think at the end, I kept telling you, oh, I want to go bigger, I think. I was kind of like, oh, they're a little small. But honestly, not a couple years, like a year or so after, I just started coming into my own. Like they kind of just felt like me, and like I was just like, you know what, they're perfect. I think I'd look crazy if I was like going any bigger. You were right. So I'm glad I listened.
Good. Yeah, I mean, there's a point where it gets too big, you know, and I think a lot of women, a lot of people don't realize that it's like bigger isn't always better, and you're signing yourself up for revisions, more likely to get revisions if we go too big, you know?
And I didn't want to be too top heavy either.
Exactly.
That was a big thing too. Like I find even when I wear push-up bras, it's like too big. So,
oh, really?
Yeah, I don't really wear bras that often.
Perfect. So I'll take credit for that.
Yeah.
Okay.
It was good.
Good. So tell us about kind of like your confidence and so forth, and after you got the breast augmentation.
I mean, like, obviously, of course, like I transitioned and like I didn't have much there. I had like a little bit, maybe like a cup, maybe. So afterwards, like just, you know, I think trans women get the breast augmentation to like obviously pass a little better. And what was important for me was like it wasn't really cosmetic. It was more of just feeling like myself and how I was supposed to be, like looking at my sister and my mother who, you know, obviously weren't born with breasts. And I went off kind of like what my sister's size were. She's tinier than me and shorter, so hers are tinier. But I just wanted the size and the boobs that I would have if I was born naturally woman, basically. So it wasn't really about looking more like sexy or anything like that. It was more just like what I was supposed to be born with.
That's
I feel.
Cool.
So yeah.
What did that's mentioned? I didn't know I never knew that actually entered in your thought process. That's actually that's news to me. That's actually interesting that you were trying to see what would I be if I were to kind of, you know, naturally have this, and I think that's really important.
Yeah.
Did you talk to your family a lot about this prior to getting the procedure, or did you tell them?
Not really. I was just like, Mom, I'm getting my boobs.
Yeah.
Like, and she didn't really like. She just said, okay, cool. Like, yeah.
Cool.
So I'm from like the country, so I feel like they don't even know what that really meant. You know?
Right. Much less like. Like versus transitioning versus, you know, breast augmentation on top of that.
I mean, my mom knew I wanted them, of course, so she was happy for me with that.
Amazing.
So, yeah.
All right, so life. Fast forward now. So tell us about, you got married. How long ago was that?
I got married in September.
Okay, tell us about.
Well, you know, I was looking for love in LA, which is like really hard, especially for trans women, like especially for us. And I kissed a lot of frogs, and it was a process. And then eventually I was just like, you know what, whatever, I'm just going to have fun with my life and like forget about it. And then I found the guy for me.
That's the only time it happens.
Yeah,
is when you're
literally.
not looking for it. It just
I just stopped and then it just happened. So it was like natural, just like a Tinder, you know, date.
Yeah.
And then it just ended up very slow, and then eventually, you know, it just started gaining into something more, and now we're married, like a year later.
Wow. So, and how's married life?
It's
coming
good.
out of COVID?
It's good. I mean, yeah, we got married. Well, yeah, the vaccines were out there, but we decided to get married fast because we were scared to get shut down again and like have to wait for like who knows how long, you know. So we decided to get married pretty quick, and ever since, like, no regrets. I love being a wife, and it's like a life adjustment, you know. It's like a little like I can't really. I mean, I used to be a little bit of a partier, but like he doesn't drink or anything like that at all. So like it's really helped me kind of like get a little more healthy and like productive and
Yeah, I don't drink much anymore either.
Now I know you're like keto sugar free. I heard.
Yeah,
I love that.
I'm really
That's
into.
like inspiring for me because I want to lose some weight and I need to do the keto.
Yeah, you know, it's just this book I read. I was reading these books about kind of how, like, you know, humans evolved, and like, you know, we didn't really eat all these many carbs all the time, and so I think our bodies can't really handle it. Our inflammation goes up, and so it's not so much about calorie counting.
Well, I love the anti-inflammatory diet.
Yeah,
I love those because inflammation really affects me.
Which foods in particular?
Mostly like breads and you know, basically pizzas, breads, sugars also.
Yeah. Now we did a little liposuction as well, right?
Yes.
Okay.
Yes.
How do you like the results of that?
They were good for a while, and like now I'm fat again. But but it's because I think what's important is that when you're recovering, which I was told, to eat really healthy when you're recovering and light and like whatever. But when you're recovering, you want to like nourish yourself, and it's not really nourishing. It's like splurging. But yeah. So I didn't really eat the healthiest. I was eating like I was trying to gain the weight after I lost. You got it sucked out basically. So. Yeah, I feel like if I would have ate a little healthier during my recovery, I would have had longer results for sure.
Yeah.
Might do it again sometime.
Okay.
Soon.
Well, is there any other procedures that you are thinking about?
No, I think I'm pretty much good. Like I didn't have too much done, honestly. Like I was lucky. So I just really wanted like my boobs and, you know, I got my trachea done.
Right.
Like before I met you.
Yeah.
And yeah, that's kind of all I've really needed to do, I feel.
Yeah.
So
great.
yeah.
Well, good. Let's see, how are we doing on time? Do we have 13 minutes? Okay, cool.
So you have the Q&A questions.
Okay, great. So why don't we dive into just a few more things, and then we'll go into Q&A. So transitioning is one thing, right? And then undergoing cosmetic surgery is the next step, right? To kind of alter your body on the outside to how you feel on the inside. Right. It's the way I look at it, right? And it's like people judge that, and people judge that for not only trans people
in general.
Yeah,
but
and
they
it just
definitely come for us a little more about it. I feel I don't know
why.
Just
because
Yeah, I mean, it's like, oh, you don't need to be a woman if you have boobs and stuff like that. But yeah, it's like it doesn't really have to do. Again, like I said earlier, it wasn't materialistic way. It was more of just like how to be more confident and like to look more passable as a woman, like in a bikini or like certain clothing, and just in general when you're looking in the mirror when you're naked, like you just want to look how you feel on the inside.
I totally believe that, and I see that in all of my patients, both cis and trans, and how much happier my patients are, and that's why I'm like a firm believer, and that's why I promote. You know, I do the top surgery. I don't do the bottom surgery, but you know, and I don't do the majority of the facial surgeries. But it's just like, you know, as long as it's within reason, do what makes you feel comfortable in your skin. You know, who cares what other people think?
Right.
And so, what would you say to someone who's already transitioned and is thinking about getting cosmetic surgery? What would you say? Tell them.
I mean, I would just do like the research as best as you can. Find the right doctor for you. You were my right fit for me.
Yeah.
You know, I wouldn't recommend going to Mexico like a lot of people do.
Have you gone to Mexico for anything?
No, never.
Okay.
I've never been to Mexico, sadly.
Really?
But no.
Oh.
Hopefully.
Okay. It's a good place to visit. I will say that.
Totally.
Probably, I don't recommend to go there for cosmetic surgery. The reason why there are good plastic surgeons there, but the problem is if you have a complication, getting across the border is a big hassle, and so
a lot of like people that have ended up in the hospitals there, they just don't get treated well and get infections. I've heard, and like
I've heard that too.
It's like kind of scary to me. So I always think like the States has the best medicine in the world and just the best doctors, and I love it here for any surgery in general.
Yeah.
But yeah, I would just like tell them to do their research and, you know, listen to your doctor and try not to get too ahead of like what other girls are telling you to do, you know? So
we had Bitter Betty on the podcast a couple months ago, and she's
sorry, who?
Her name is her Instagram is Bitter Betty,
okay.
And she's on the drag show. Gosh, what is the name of that show?
Drag Race.
I forget the name.
RuPaul's Drag Race.
Dragula, yeah, she was a contestant on Dragula, and she came on the show. She's not a patient of mine, but she talked about a lot of. She was from Tennessee, and she got her lips injected with medical grade silicone. Yes.
Oh my God, yeah,
have you heard about some of these underground types of things?
I know a lot about them.
Okay. Because it really scares me because there's a lot of trans patients. Trans people who don't have the financial resources, and this is a major.
It's cheaper for sure,
right?
And like a lot. I think like the most popular place is Florida, like Miami, is to like get silicone injections in your butt, and like that's like I'd watched a documentary, and it's like Miami's like the capital of that for some reason.
My God. Yeah.
But a lot of trans women, like they want like they want the hips, they want the tits, and like all that. Sorry if I can say
for
that.
a fraction of the price. Yeah.
And they do a lot of like silicone injections, and I've met a lot of girls that have that, and like if I know them well enough, like I'll ask to like feel it because I'm so curious of like what it feels like. I felt ones that felt like literally like cement.
Yeah.
Like it doesn't look like it. It's weird. Like it looks fine, and then you touch it, and it's like a couch cushion, but like a harder cushion. Yeah. And then some feel like a very thin water balloon, kind of.
Yep. So that's the thing. It's different for everybody, and that's the problem for some people. And by the way, I'm going on the record. I do not ever recommend injecting raw silicone in your body. Okay, but for some people, it actually works out. And
I mean, any
scary.
day you could pop, though. I mean, you're never really safe.
Or it travels, it gets infected. That's the problem, right?
It travels, and I've met a lot of people who it goes down to their thighs, and also it's called staining, where it looks like bruises on them. Yeah. But it's staining, it's called. Like, it's a thing. The girl called it staining, which is like basically all these purple, yellowish marks where it was. And that's like a form of like rotting, you know, like it's kind of really scary.
That is scary.
So obviously as a trans woman, I was tempted to like look like that sometimes. And I just never wanted to go down that route because like the risk is like just not worth it to me.
You're right. You're gambling with your life, really, because when I was in my residency, and I've seen a few since then, where if these injections get infected, there's no way to really clear.
And a lot of doctors won't do it.
Exactly.
Like it's just so risky, and then you end up deformed if you do get it out.
Right.
It's like
they have to cut everything out.
It's like you're way worse than when you were.
I know. It's not worth it.
Yeah, I definitely never recommend that to people either.
Yeah.
I'm not really a huge fan of injections anymore. Like I got my lips done a couple times, I think, but I haven't touched my lips in like 4 years.
Yeah,
these are mine.
Yeah,
so
I know.
I'm thankful that I don't need to get them done. But I feel like I won't probably touch fillers until I'm probably like 40. Because I feel like the younger you do it, like kind of stretches you out more, or is that a thing? Like you would know more than me.
Well, yeah, I think you just need to be careful with who you go to and just be very modest with it. But I think you're beautiful. You have great volume. I wouldn't even think about it. Even if you ask me. Yes.
Yeah. I love that.
Fillers, a lot of people don't need fillers, so don't get it, you know. And I think the whole Kylie Jenner thing is kind of gone, where people kind of get that exaggerated look. I think people are dialing it back to more natural looks.
I think so. Yeah.
Well, good. Well, so I want to go and do some Q&A with some of the viewers. They had some questions, and some of our listeners and some of our audience. So we talked about transitioning. Did you find? So we actually didn't talk about transitioning. Do you want to touch on that really quick and just talk about maybe resources that you found when you were transitioning? I know this was a long time ago.
Yeah. No. I mean.
That you found were helpful.
Like nowadays, even before 5 years ago, like there was these like LGBT clinics basically where you go, and if you wanted to, like I just went and said I want to transition, and the nurse basically, I didn't need therapy. I think that's like more for smaller states and things like that. But
how old were you?
I was 23.
Okay.
22 maybe. I'm 29 this week. So
happy birthday.
Thank you.
Yeah.
But yeah, so about 7 years ago now.
Okay.
I don't know what that is. But anyway, I went to the clinic and he just like gave me hormones right then and there and was like, yeah.
That was in California?
No, that was New York.
Okay.
But they are here all over,
Okay.
here and there. So I would just recommend like going to your resources as the LGBT center and like talking to your nurses, doctors, and they'll basically fix you up with whatever you need.
Amazing.
So, yeah.
I don't know if you know this, but there's a lot of health insurance, and there's also companies that are actually covering.
Starbucks is one of them,
Yes.
I've heard, which
Yes.
I worked at Starbucks back in the day, and I wish that was a thing back then.
They're actually
but-
covering breast augmentation surgery.
Yeah, that's wild.
Yeah, so we've actually had a fair amount of people from these companies and from these insurance plans come to see us.
That's cool.
Yeah.
Yeah, I mean, that's amazing because I know that a lot of plastic surgeons don't really go through any insurances like that. So
Yes. So we're out of network, but it's something we specialize in. There's not a whole lot of plastic surgeons that do trans breast augmentation. So I think they recognize that, and they're still happy to sign up with us out of network. And
yeah,
so,
that's great. I think that's amazing. I mean, I'm from Canada again, and the healthcare there, it's covered anywhere.
Is it? Okay, so
yeah,
can you get a breast augmentation up there in
I
Canada?
could, if,
Okay.
yeah, I wanted to, and just say it's like for my mental health, basically.
Okay.
Yeah.
The question is there a good breast augmentation?
well, that's the thing.
Yeah.
Sometimes, like if it's through insurance, like it's you can't really choose your doctor,
Right.
you know, so you kind of like are left with whatever they can give you.
Mm-hmm.
I haven't seen too many people that have gotten them in Canada, so I can't really tell like what the results were, but you know, again, like I could have went to Canada, but I chose you because I want to pay for what I get.
Yes.
You know?
You get what you pay for. Yeah, I would say. There's probably a lot of good doctors in Canada, but, you know, it has to be the right fit.
Mm-hmm,
And
totally.
You want to do your
yeah.
research. So, okay. And then if you could be on the cover of any magazine, what would it be?
Vogue, period. Yeah.
Yeah.
That's the best one, I think,
All right.
in my opinion.
I feel like I could see you on the cover of
Oh,
Vogue.
I don't know.
I feel like I could go in the airport and I look
maybe
over and
if
I see
I-
Siobhan on the cover of Vogue.
Maybe if I get that fresh lipo.
There you go.
I could.
And then, okay, so have we done some modeling?
Oh, yeah, I was a full-time model back in the day.
Okay,
for sure.
tell us about that. Tell us some struggles that you went through being a model and a trans model.
Well, definitely a lot of struggles. For one, like just getting someone to take me seriously as like a trans person model, because back then there really wasn't many.
So you say
around.
back then, like how many?
Sorry, it seems like a lifetime
know.
ago, but it was like 7 years ago. 2014 is when I got into it, and I
Yeah.
got signed to Ford Models, which is like a huge agency.
Right.
And I just came from like a farm town on a dairy farm, like you know what
Yeah.
I mean. So,
Where is that in Canada, by the way? I'm just curious.
Nova Scotia.
Oh, wow, that's
Yeah,
really up
down
there.
east.
Yeah.
Very east.
Okay.
So, yeah, so that was like really cool and like a thing that I just like something that no one really comes by from where I'm from.
Yeah.
So I was like, just packed my bags, went and whatever. And back then I wasn't really trans yet. I was
Yeah.
more like androgynous, kind of doing like the androgynous modeling, which was like a thing then. Like
Yeah.
I like basically started working right when I started because it was such like a hot topic, like doing more male modeling and female modeling, and you could do both jobs in one. So
Okay.
I was like the perfect candidate for that.
Awesome.
Like, so that was great. And I had a really good experience going to Europe and Korea, and didn't really like Korea too much, but it was great for work and
Yeah.
whatever. But then I came to New York, and that's when it got hard. That was
Okay.
like the struggle, because New York is like the most competitive city for the fashion industry. So
Yeah.
being trans, also having a big foot, being a little too tall sometimes was a struggle, and I got declined a lot of jobs sometimes. And especially when I transitioned, it was harder because I was just a basic female model. I wasn't really doing the pigeonholing stuff of like being androgynous and like
Okay.
kind of certain jobs I would get for that. I would just be a female model. So I kind of got looked at as that, which I wanted, but at the
Yeah.
end I was kind of like, oh shit, now I'm like kind of, it's more competition. So yeah.
You ever see the movie Zoolander?
Mhm.
Where he goes back.
Yeah.
He goes back to like the farm, the mining family. You ever like? Do you ever? Like, is your family like Nova Scotia? Like, do they have like a farm and you go back there or no?
Oh yeah, I mean,
Okay.
again,
I just like picturing you know, you go
it's
back.
basically like that.
Yeah.
Like we we have cows on my lawn. So, well, we did. We moved off the farm quite a few years ago, but my family still owns it. So I have cows there that are still alive from when I was like 10.
Wow.
So, yeah, we didn't slaughter the cows. We just use them for milk and stuff. But yeah, it's basically like that.
What a crazy world this is. You start out there and like cows in your front yard, and now you're
never went on a plane before, and then just went to Toronto. It's like where I started, and then Europe, and that was really fun, and then New York, and then I retired from modeling 2016. So and I came here and kind of just hung out. So
no, I mean I've seen all your photos. They're just amazing. Do you feel like you'll ever get back into modeling, or
I don't think so. No, I've kind of lost my passion for it.
What are you passionate about now?
Right now, I'm really passionate in politics.
Okay.
And I really love law enforcement, so I plan to be a cop, actually.
What?
Yeah, I want to go into cops training.
Oh my gosh.
In a couple years.
Okay.
So.
Well, tell me about that. That's kind of interesting because there's a lot of things going on with the police right now, and people are talking about defunding the police department.
Yeah.
What are your thoughts on that?
I mean, definitely, like, I love law and order.
Yeah.
And as a trans woman myself, I always felt really safe having police there and around me. And yes, I have privilege being white, of course, but also being trans woman, that's like a big disprivilege for me.
Right.
And I love law and order, and I have a big passion for law enforcement. So that's something I really want to get into and become.
Yeah,
so.
well, my father was a police officer, and two of my brothers are police officers,
Wow.
and it's really tough. It's
hard.
Yeah, it's you. Not all police officers, but a lot of them, they deal with a certain element of society that is kind of the negative side, right? All the time, and that could kind of get draining at some point. So
yeah, totally.
I feel like you have to be very strong character to maintain.
And I think like I've been through a lot, and I've been like just threatened and in society, and just always felt like I'm not safe and whatever. But I think since I've been through all that, I can handle whatever that is going to be, like the hard training, and like also it's very rewarding because you have to be like physically like get into shape and like do all that, and that would also be kind of a rewarding thing to kind of say and do. And
absolutely.
Well,
so you should.
That's my future plan.
I have a dream of you being a Beverly Hills police officer. You coming by the office
and cute outfits too.
Yeah.
It's
amazing.
like cool, like from model to police officer. It's
from farm to model to police.
And I don't think there's ever been a trans police officer ever. So
well,
I can't
there you go.
say, but I don't think.
Yeah.
So.
All right. Well, wonderful, Siobhan. Is there so that's about it for the show in terms of time? Is there anything else you'd like to share with the listeners? Do you want them to follow you on any particular platform?
You can follow me at Siobhan with 2 N's .Garcia. That's my Instagram.
All right.
Other than that, I think I'm good though.
Wonderful.
Well,
thank you so much for being on the show. We're very good, and I'm very grateful
for
you.
having me here.
You're beautiful, and thanks for sharing your story.
Thank you.